the Medical AI Podcast.
Welcome to the Medical AI Podcast with me, Dr. Felix Beecher. Strap in for a 30-minute thrill ride of big ideas. Imagine a doctor telling you that you need a biopsy, and then he or she tells you that the biopsy is going to be in your brain. Well, you might well panic, but then you learn that there will be no drilling through the skull. This is a non-invasive biopsy, and it uses a technique known as hydrogen magnetic resonance spectroscopy. And it could be the coolest type of neuroimaging you have never heard of. So, what is it? How can it help? And how is AI advancing this technique? Well, with me is Professor Alex Lin of Harvard Medical School, a foremost expert in this field. Alex, I am absolutely delighted to have you in the podcast, so welcome.
Thank you, Felix. I really appreciate the opportunity to talk to you, and especially to talk to someone who has some experience in this field. So
that's right. Yes, no, that is a particular thrill for me because this was a big part of my PhD. But that was a long time ago in the olden days when nobody was very much talking about AI. So it's fantastic to have you on. So Alex, perhaps we could start just defining our terms. Could you tell us what magnetic resonance spectroscopy is? Let's just say MRS. So could you describe what this is and how it's useful?
Sure. I mean, everyone's heard of MRI, and we use the exact same machines to be able to look at MRS. But the difference is instead of getting pictures of the brain, we are measuring chemistry within the brain. And it's what we like calling a virtual biopsy because, as you know, the word spectroscopy is not something that a lot of people are familiar with. And it really is exactly as I described. It's allowing us to measure chemistry in the brain to get a better idea of what's going on in that part of the brain that we're looking at. We can measure chemicals called like N-acetylaspartate, minoxidilcholine, glutamate. I won't go into the specific details of all of these, but the important part is all of these chemicals represent certain biological processes in the brain that then help us to better understand what's going on in terms of different diseases. And I think the most recent work that's been done in the MRS world has been in looking at one specific chemical called 2-hydroxyglutarate. And the reason why it's important is because it's a 100% specific marker for brain tumors. You don't find this in the brain unless you have a certain genetic mutation that causes this chemical to be produced. And so, with that, we're able to get this virtual biopsy to be able to determine whether or not there's a tumor within the brain and not have to do any kind of drilling, as you mentioned, in order to determine that.
There is so much to talk about. It's hard to know quite where to begin. Perhaps, let's just imagine that somebody is going for an MRS scan. Now, how might their experience in the scanner be different from a regular MRI?
It wouldn't feel that different. The beauty of spectroscopy is it doesn't require any additional injections of any type, not like PET scanning where you have a radioactive dye. We're using the endogenous chemicals that are found within the brain. And so, honestly, the only difference is it sounds a little bit different. It's a little bit more quiet. It's not that bat, 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 bat type noise you hear in an MRI, but more of a kadunk, kadunk. And so it's actually, I find it much more peaceful than a standard MRI. But, in terms of how you feel, it's not going to be any different from standard MRI.
Now, I suppose by way of analogy, when astronomers look at starlight from a distant star, they can get a light spectrum, which can measure the composition of the chemical makeup coming from that star. And that's a spectrum very much like the kind of spectrum we get from the brain, right? Does that analogy work, do you think?
Absolutely, yeah. It's the exact same methodology. What we're doing is we're getting the signal that's coming, like say from the star, but instead now from the brain. And each of those different peaks that you'll see in the spectrum represent a different chemical. And the height of that peak tells you how much you have of that chemical. And the patterns that emerge from the spectrum are then what becomes, useful from an AI perspective of being able to discern whether it's a brain tumor versus healthy tissue. As you can imagine, a brain tumor is going to have a very different chemical composition than normal brain tissue, and that the generation of the spectrum allows us to measure these kind of differences.
So just to be clear, the output data from an MRS scan, is very different from what we normally think of as neuroimaging, right? It is a squiggly line rather than a picture of the brain.
Exactly, and I think that's been one of the kind of major challenges in our field has been that clinicians are not used to looking at that. Radiologists are used to looking at pictures. If you see something that's big, bright, and white, it's generally bad, and that's how you get your diagnosis. For spectroscopy, you have to break down those chemicals, get those measurements. The advantage of this is that it's very, very quantitative as a result, and so we can get at much greater detail and better understanding what's going on pathophysiologically in the brain.
So, yeah, and I can imagine from the perspective of a radiologist that must be a bit of a jolt, right? Because normally on an X-ray or a CT scan or a PET scan, you can see what's going on in bits of the brain that you can recognize. That's completely different with MRS, right? So you essentially you need software and data analytics to interpret for you kind of what's going on, right?
Exactly right, and I think this has been the major challenge in our field is how do we bring this into the clinic when it's something that radiologists and clinicians in general are not something that's used to looking at. So one of the things we've done is to really translate this technology almost like a blood test in the sense that when you go for a blood test, you come back, you have a little graph that comes out with little bars on it that tell you, oh, your LDL is a little too high or HDL is a little too low, your cholesterol levels are too high. Any person, whether you're a clinician or a patient, can understand that. And what we've done with this technology is to change it from the typical look of a spectrum to that of a blood test, where we can give different normative ranges and allow us to tell, is your certain chemical too low or too high, and then subsequently what's its relationship to the disease that we're looking at.
Okay, so people will be familiar with brain imaging techniques like MRI and PET and so forth. So what's special about MRS? How does it add value on top of those kind of what you might call conventional neuroimaging techniques?
Yeah, absolutely. There's, it depends on which different disease. We'll start first with brain cancer, which is the one we started with. It allows us to measure changes non-invasively, but also without any kind of radioactivity. So a PET scan will give you radioactivity. The MRI portion will tell you what kind of changes are occurring, but they don't tell you what's going on chemically. So it's really the best of both worlds when you compare MRI and PET, in that we get these measurements without having to do anything that's radioactive. And so you can repeat it time and time again. And I think that's really the strong advantage of spectroscopy, is that not only is it quantitative, so you can compare from the scan that we did 3 months ago to the scan that we do now to see, are there any changes that have occurred? And that's really what a lot of our patients come in for, is we'll look to see, you have a lesion in the brain, use spectroscopy to better understand what's going on in there, and then we'll follow them for the next couple of months and see, do we see any changes in that chemistry that would tell us that potentially the tumor is progressing, or better yet, that the tumor is staying fine and you don't have to worry about it. You don't need to do additional chemotherapy or radiotherapy. And this really helps inform the clinicians as to how we can manage the patient better by looking at the brain chemistry.
Well, let's talk about disease areas, and then we'll come on to the question of AI and how that's helping to advance MRS analysis. So let's understand first what kind of clinical applications there are of MRIs. You mentioned brain tumours in particular. Are there specific types of tumours that can be measured with MRS, or is it a general technique for brain tumour detection?
It could be used generally, but I think there are specific applications where this technology becomes really valuable. And I think for us, measuring tumors that are in the brainstem is one of the key applications, because this is an area where you do not want a biopsy. The chance of paralysis or potentially death from a biopsy are much, much higher when you get down deep into the brain. And here's where the technology really shines, in that we can assess that non-invasively and be able to get at that. And it's why the FDA, for example, has given special designation for technologies that allow us to do this non-invasively and help save lives.
Now, when I did my doctoral research, that was in the field of Alzheimer's.
Mhm.
Could you talk a little bit about what kind of MRS and Alzheimer's, what the research has turned up in the last 20 years, say?
Yeah, it's in many ways the technology itself hasn't really changed a whole lot, but the degree of accuracy that we can get with it has really improved. So we've known for a long time now that in the Alzheimer's brain, the chemistry is very, very different. The work that you did in Down syndrome and Alzheimer's has demonstrated decreased N-acetylaspartate, increased myoinositol, and we've known that for a long time now. The problem, I think, particularly in Alzheimer's, is that we really need to get at Alzheimer's at earlier stages. And I think the work that's been done more recently demonstrates that you can see changes in mild cognitive impairment state. So this is the kind of early stages of Alzheimer's. And then there's some really nice work coming out of the Mayo Clinic that demonstrates that myoinositol changes even in the preclinical stages. So before there are even any kind of symptomatic changes within the patients, we can detect those changes and predict who's going to go on to develop Alzheimer's and not. And this allows us to then get at Alzheimer's in that very early stage where treatments can then be more effective.
Okay, so apart from Alzheimer's and brain tumours, what other kinds of clinical applications are there for MRS?
Yeah, I think what's wonderful about spectroscopy is that it allows us to look at the virtual biopsy allows us to look at all different aspects of changes in chemistry in the brain. So we have everything from one major area of research that I've been focusing on is in brain injury. So looking at the effects of concussion, and here in the United States, one of the prominent sports is American football. And there's been a lot of talk about what are the long-term effects of concussion in these football players. There's a disease called chronic traumatic encephalopathy that has emerged that is a neurodegenerative disease that really we have no way of knowing what's going on in the brain of those football players. Their brains look fairly normal from an MRI perspective, but there are all these other biochemical changes that we're starting to better understand so that we can, again, very similar to Alzheimer's disease, be able to predict this, pick it up in early stages so that we can then treat these patients. And then
Yeah,
I'm sorry.
sorry. Go on.
I was just going to say there are other applications also in pediatrics. We see that the virtual biopsy is being used across a lot of children's hospitals where used to diagnose metabolic disorders. And then I think one area that I'm particularly excited about is in anoxia. So these are patients that perhaps post cardiac arrest, they're in a coma, and we can actually use spectroscopy to predict whether or not they'll come out of that coma or not, based on the biochemical changes.
Okay, right. So we have a very versatile form of neuroimaging that can do things that other forms of neuroimaging cannot.
Mm-hmm.
I think one key question here is MRS typically used on its own, or are there attempts to combine MRS data with other forms of clinical data to come up with more accurate diagnostics or other measures?
Yeah, absolutely. I mean, it can be used on its own. For example, in the 2H spectroscopy, that's been something that's been utilized heavily in the clinic. But it's always best in combination with other modalities. I think, for example, in the anoxia one I just mentioned, we've looked at things like diffusion imaging and shown how by combining the diffusion measures with the spectroscopy measures, we get at ultimately the best predictors for outcome in those patients.
Yeah.
And so and there's nothing, you don't have to do spectroscopy independently. It could be done in conjunction with all these other imaging technologies. It's sometimes as quick as a 5-minute add-on to the standard protocols that are being done in the clinic.
Now, I know this is a very tough question, this next one, but could you give a kind of general overview of the accuracy of MRS with respect to diagnosing these kinds of conditions?
Yeah, absolutely. I think the specificity of spectroscopy can be very, very high. For example, I mentioned before with 2-hydroxyglutarate, this is not found in the brain unless you have that tumor. So if you detect it, 100% chance that it's going to be a tumor. It's, I think, where sensitivity has always been the challenge for spectroscopy, because if you compare spectroscopy, say, to MRI, the MRI signal is literally orders of magnitude higher in terms of the amount of signal that we get. So we're operating at very, very low signal strength, and so that's where the challenges come in. Is how sensitive can we get? So, for example, if the tumor is much smaller, say down to millimeter size, it's going to be a little bit more challenging for us to detect
Yeah.
it, and so that's where some of the challenges that can arise from spectroscopy.
Yeah. Okay. Now, I've often pondered the fact that a spectrum from an MRS scan is a highly complex thing, right? I mean, you have the peaks that correspond to particular metabolites. You also have lots of kind of what looks like noise, but maybe is not noise. And then you have relationships between the peaks, which could be informative, but tended not to get measured. Now, this brings us on, I think, to the question of how AI approaches can change MRS analysis. Could you speak to that?
Absolutely, and exactly as you just said, the big challenges with all these different chemicals that we measure is that they overlap one another, and so we really have to use pattern recognition techniques and artificial intelligence to get at better differentiating between these different chemicals. For example, glutamate and glutamine are two chemicals that are very different in their roles in the brain, but their chemical structures are very similar, and so their peaks overlap significantly in the MRS. And so using AI, we can then separate out those peaks so that we can accurately measure them independently and get at better understanding what's going on pathophysiologically in those different diseases.
So could you just unpack what the AI component of these kind of analytical techniques is?
Yeah, so it basically we can generate models of what we expect those chemicals to look like, right? We know what the different peaks for N-acetylaspartate are. We know what the different peaks are for glutamate, and an AI effectively uses these models and fits the data, and that gives us an idea of how well quantified we can get these different metabolites, and what are the differences. What is what is the accuracy of that quantification? And I think that's also an important part of the AI, is that not only can we tell what is what with the methodology, but also the degree of accuracy and confidence that we have in that measurement.
So what kind of algorithms are involved here? Is it convolutional neural networks, or is it kind of more standard algorithms like, I don't know, random forests? Or could you just explain that a little bit?
Yeah, I think it depends obviously on the particular application that you're looking at. But a lot of it are fitting algorithms. So a lot of the signal processing type AI technologies that have emerged have been really beneficial in doing that. Random forest and all that, and those kind of methodologies are certainly useful when it comes to pattern recognition between different patterns of, say, for example, in different diseases. And I think what we're seeing with the technology is helping us to visualize things that are normally not seen within the spectrum by eye, and we're able to characterize them in a much greater detail.
Because I think some people will be familiar with the use of convolutional neural networks for images, the kind of images that come out of scanners, and then also they may be familiar with the kind of algorithms that are used to analyze tabular data, but spectra are a bit different from both of those things, which is kind of the gist of my question.
Yeah, so I mean, I think a lot of it will be based on prior knowledge being inputted into the models that we look at, and so looking at some of those patterns and knowing them ahead of time, what we expect to see, we can then use the convolution methods or other AI methods to better understand the differences between the different chemicals. And then I think at a higher level, we then also have the AI technologies that are looking at, for example, can we tell between this type of brain tumor versus another type of brain tumor, because we expect the patterns to be different in these different tumors. We can use these AI algorithms to also help differentiate those kind of things.
Now, MRS is not as well known as MRI or PET or CT. Why is that? What are the why is it not as well known, do you think?
I think it's there's a challenge in really in how we visualize the data. As you mentioned before, we get a spectrum. It's not a image of the brain. One of the things that we're certainly moving towards in the future is to develop whole brain, for example, imaging, spectroscopic imaging methods, where you can generate, a color map, so to speak, of each
Yeah.
of the different chemicals, and that allows us to get a better visualization of it. But the technology isn't really, quite there yet. And so, what we're hoping is that with the development of other ways of visualizing data, like I said, with like kind of like a blood test,
Yeah.
then that'll allow us to take this technology and move it into the clinic today.
And is it the case that it's still rather specialist in terms of radiologists' training? Is that an obstacle too?
Yeah, absolutely. I think the familiarity of radiologists with the methodology is a key one. So you'll see most of this technology being used in large academic centers. And what we'd really love to see is that this technology be spread down to non-academic centers, to rural centers, where you have the machines to do this. You have
Yeah.
MRI scanners available, but you just don't have the understanding of the technology. And so, our hope is with some of the software that we're developing that we can move towards that. Because we can make it as simple as a blood test, then just like your test that you do for your patients, where you can get blood at any clinic and then send it out to a central place to have it all processed.
Yeah.
This is the same idea that we could do the same thing and provide that technology to non-academic centers as well.
So, Alex, what would be the advantage of being able to perform multiple biopsies from multiple regions in the brain all at one time?
Yeah, that would be so. That would be very valuable from a standpoint. It again depends on different diseases, but for example, in a brain tumor, um, trying to look at see where the tumor might be spreading to, so that we can, for example, apply more radiochemotherapy to certain regions. So that would be one advantage of being able to do it in multiple regions. Then there are other diseases where there are multiple regions that are being affected. Like for example, in concussion. Um, when you get a concussion, you don't determine the direction in which you're hit, and so different parts of the brain will be affected differently. And so being able to get a kind of whole brain approach to measuring the virtual biopsy would allow us to better characterize some of the differences between different types of injury.
Okay, so at the moment we can only sample from a kind of small volume called a voxel in the brain, right? But you're talking about an entire 3D grid covering the whole brain. Is that correct?
That's absolutely correct. Yeah.
And so, what do you think is needed to get MRS more into clinical use than currently?
So I think there's be two aspects to it. One of it is to have a lot of these more advanced technologies adopted into MRI systems. So you have specialized sequences that you need, for example, to do the whole brain imaging. But then the second part, which is the part that we focus on more, is having the software available to decode all of this and present it in a way that's easy to understand,
Yeah.
not just from radiologist standpoint, but the clinicians and the patients as well. I think when you're given a blood test, okay, I need to cut down on my donuts because my cholesterol levels are getting too high. We want that same type of easy to understand interface when looking at the virtual biopsy results.
Well, that brings us very nicely onto brain spec, right? Could you talk about brain spec? What was the idea? How did the company come about? Could you talk us through that?
Yes, I mean it was great. The Brigham and Women's Hospital brought together people from Harvard Medical School, Harvard Business School, MIT, and then interestingly enough, also from the Mass Arts. And we got together in a group on a hackathon and came up with ideas to try to determine, how can we move these technologies forward. And in the back of my mind has always been this idea of let's make spectroscopy simple. And make this virtual biopsy a reality. And so we pitched the idea, and from that we found a CEO from Harvard Business School, Alex Zimmerman, who was really interested in the project. And about this is now 5 years ago, really took this on, formed a company. We brought on the software developers to develop the software to make this idea a reality, to make it simple, make it just like a blood test, and make it available to clinicians all across the country.
And where are you at currently with brain spec?
So we recently received FDA approval to to utilize the software in clinical practice. So we're now setting out to different hospitals all across the country and across the world, for that matter, to utilize this technology in their clinical practice.
Okay, and how are those discussions going with the FDA? And also, I'd be interested to know, what's your ambition for the company in terms of profitability and evangelizing the concept and so forth?
Yeah, I guess the FDA has been fully behind it. I think it's been it was a long journey, but one that was really important because they were really keen on making sure that our measurements were very accurate with the software, and I think that's really, really important. And so now that we've gone through all that, we have the confidence now to go out into the market and get everyone using this as much as possible. And we're starting to see more and more people starting to use it. We just recently published a paper with a group that used it for looking at concussion and traumatic brain injury, and shown how using spectroscopy through BrainSpec, they were able to add to the diagnosis in conjunction with multimodal imaging with like diffusion imaging and other modalities.
Fantastic. Well, I remember in the olden days that the part of the art of MR spectroscopy was not just the analysis, but it was also in the acquisition of the data. Is that still a difficult thing to achieve?
It's gotten better through the years. I think it depends on now it's available across every single MRI scanner. So it's GE, Philips, Siemens, all have that available. There are still some challenges. One of the aspects that BrainSpec is dealing with that we just acquired a methodology that will automate the placement of the voxels.
Yeah.
So that, for example, if you want to measure the posterior cingulate or the temporal lobe, we can just program it in. We don't have to have the technologist try to figure it out. And we're working also with other companies to ensure that the data that we get from that region is the optimal data.
Well, Alex, it's been an absolutely fascinating overview. I think you've given a magnificent summary of a very complex and wide area of research. So thank you for that. Look, before I let you go, though, Alex, let me ask you to think more widely outside spectroscopy. Could you give the listeners an example, not just an example, your favorite example of medical AI in general, nothing to do with brain spectroscopy?
Yeah, I thought about this, and I have to admit that it's I think it's probably the most popular use of medical AI right now. But being able to speed up the MRI exams, I mean, I think everyone knows being inside the MRI scanner is not the world's funnest thing to do, and so be able to speed it up really is something that will really advance the field. It'll be better for the patients, make it more comfortable. And then we can also increase the throughput for our patients. So I think that's something that is definitely one of the most exciting developments within the medical AI field.
That's a great example. And let's just circle back to MRS. How long does it take for a radiographer to obtain a spectrum from a brainstem, typically?
Yeah, so 5 minutes is really all you need. With a single voxel method, you can do it within 5 minutes and get all this information from the tumor.
Alex, it's been an absolute pleasure. I'm very, very grateful to you. So thank you very much indeed, and good luck with your research.
Great. Thank you so much, Felix. Really appreciate the opportunity.
Thanks for listening. Ping me on LinkedIn if you have any ideas on new subjects or guests.